I'm,
Sibi,
hello. Go ahead.
Sibi, are you there? Listen, did you email Professor Kathleen regarding the video?
No, actually, I sent
Did you
an
send her
video.
an email?
Yeah, email to Professor Bogart, who is in PDX, not to
Huh?
Professor Marvel.
Okay. So we'll get that. I'll get that
Oh,
resent. I'll get that resent after
Yeah,
class today.
that video was not opening for me.
Okay. Okay. So like I said, in the event that that happens in the future, if somebody could or anybody could email me and just let me know that. And I'll go back into my YouTube account and make sure that uploaded correctly and then resend it. Okay. Okay. So welcome to week 2. Hang on 1 second. I'm just going to mute the background noise. Okay. So welcome to week 2. Glad everybody came back this week. Questions from last week. Anybody have any questions from our week 1 orientation? Everybody getting organized? All your classes are situated and you've been to all your other classes? Okay. Okay. So the first thing we're going to do today is we're going to do the quiz. Okay. After the quiz, we'll review contents from weeks 1 and 2. Okay. And then we'll talk about a few things that I'm working on that you should have by the end of the day. By the end of the day, you should have your master schedule of all the reviews for exams 1, 2, 3, and the HESI. I just finally got the last dates of one of my teammates yesterday, and so I'll put those into the document this morning after class and send that to you. Because remember, next week is week 3. Okay, so week 3 is a review week because your exam is in week 4, right? And so you'll have the opportunity to attend 3 different reviews next week. I think they are on Tuesday, maybe Thursday and Saturday. So you'll have the opportunity to attend any of the 3 reviews next week. And then we all share our recordings. So you'll have the recordings of all 3 reviews as well. Okay. And this document gives you reviews for exams 2, 3, and the HESI as well. So you can plan ahead if you would like to with work schedules and home schedules. Okay, so that will be coming this morning or sometime today. And then your concept guide for review for exam 1 will be coming to you over the weekend. Okay, I'm working on that as we speak, and I'm almost done with it. Not quite, but I'm almost done with it. So I'll have that to you over the weekend. So you have it a couple of weeks ahead of time. Okay, or a week and a half ahead of time. Okay. And then the last thing that you'll have this weekend is your groups. I'm going to do my best to try and assign groups within your campuses. A lot of students like that because when they're on campus, they can work in person if they want to. Okay, so you'll have that over the weekend as well. What am I forgetting? I think that's it. Does anybody have any questions before we get going on the quiz? So I've opened the quiz for you. It's quiz 1, and it's one of those KGA assignments, key graded assessment. So it has to be proctored. So I need everybody to keep their cameras on. I realize you may not need the whole 15 minutes, but please keep your cameras on. Okay. If you have to go to the restroom or get a drink, that's fine. I don't need to know when you're done because I'll see when you submitted in the grade book. Don't forget to submit when you're done. We can't review it until everybody has submitted it. Okay. So we'll take 15 minutes. Okay, so that will bring us to, it's 9:05 now. That will bring us to 9:20. How does that sound? Um, Ter- Teresa, I think, yes, I believe you are in the right class. I'll check my roster, but
I don't
uh,
see none of my other classmates. That's why I was like a little bit confused. Like, is this the right class right now?
well, what section are you scheduled for?
Um, I know I'm with Scranton.
Okay, can you get into the module?
Yeah, I clicked on
Okay.
it from the announcement.
Okay,
Okay.
then you're good.
Okay.
You're good. Okay, so why doesn't everybody go ahead and get started with quiz one? Again, stay on camera, and I'm going to mute myself and everybody mute as well. And then we'll come back in 15 minutes. How's that? Okay. How's everybody coming? Okay, looks like some people are still working on it. Make sure you submit it when you're done. Who's still working on it? Could you give me a wave? Gina, okay. All right. Okay. Need to do maybe 5 more minutes. How's that? Okay, Aaliyah, are you all done? Makara, you all done? Okay, thank you. Make sure you submit it. How'd you guys do?
So.
So.
I got a question.
Sure.
Well, I'm just gonna be honest. I ain't study for this. I ain't read nothing or nothing. I just went off the top of my brain.
Okay.
So what should I be like? Because when I push on the modules and I push on like week 1 reading, week 2 reading, it's a whole lot of stuff. Like it's a whole lot of different stuff. So am I just supposed to read like chapters 1, chapters 11, chapters 12, or do I supposed to read like everything that you got on there? Like, what do I solely need to read so I can be like prepared for the exam?
So you're responsible for the readings that are in your modules.
Okay.
Okay.
From the fundamentals book, correct?
Well, we can go back and let's see. Share my screen here. So for this particular quiz, in your week 1 reading, that's what you were responsible for. Your chapter 1 in your fundamentals book, just one page in your med surge book. Okay.
Okay. So, okay.
Yep. And then I went through last week what your Canvas course reading is. Those are right in your module.
Okay.
Okay. And then for week 2, there were a couple of chapters in your fundamentals book, 11 and 12. And then there were in your peds book, maternity and peds book, there were a few pages from each chapter addressing each of these. So you didn't have to read all these chapters, just the pages. Okay, so you're responsible for the readings as well as I send you pretty detailed notes. Montoya, have you taken a look at the notes that I've sent you for weeks 1 and 2?
No, I
Okay.
haven't looked at.
Okay, so that would be that would be what I would be doing to prepare for class, and prepare for these quizzes. Your weekly concept notes that I'm sending. Are others of you finding those helpful? They're really deep, they're detailed, and they're addressing the concepts that we're talking about this week or last week and this week. Okay, so I put those concept notes together from a couple of places, from my lecture plans and from your readings. Okay, now, as I talked about last week, if you are responsible for a full chapter, like this week, you're responsible for chapters 11 and 12, those PowerPoints are in your readings. Did you see that? Anybody? I mean,
Yeah, I
it's,
see
Yes.
this chart.
pardon me?
Is it the PowerPoints, the 11 and 12,
Mhm,
like on
mhm.
here? Okay, yeah.
Yeah, they're all right here, right? So when you pull up your module for week 2, we know that one of the concepts we're covering in week 2 is common childhood ailments, right? Okay, so here's all the reading that you're assigned to that from your maternity book. Just go in and look at those pages only. That's what you're responsible for, those pages only. Okay? In your fundamentals, you're responsible for chapters 11 and 12. Okay, and when you go down to reading resources, here's your PowerPoints for 11 and 12. Whenever you're assigned a full chapter, you're going to have a PowerPoint, but you're not going to have a PowerPoint for all these chapters, these pages up here. But when you do have a full chapter, you're going to get the PowerPoint. Does that make sense? So to prepare for class, I would be reviewing your readings that you're responsible for, and I would be reviewing the notes that I send weekly. Other than that, that's it. That's what the quizzes are going to be about. Okay. And remember that the quizzes will go through quiz 1 now. They're clinical, right? It's taking the knowledge that you have and putting it into using your best clinical judgment.
Hello. I'm sorry. I
Oh.
know I've been through this last week. I'm pretty certain that I had a different class this week. I'm definitely on your roster, right?
Yeah,
Unless
you
they
are.
just switched me and didn't tell me.
I have you on my roster.
Okay, because I was in a whole different. We
No,
went over this last week and everything. I was just wondering. 'Cause
We
I'm
went
com-
over what? We went over what last week?
The class I was in last week, we went over.
You were in
what
my
chap-
class last week.
I was. I wasn't.
Oh, no.
I
Were you
wasn't. No.
No, did you go to the other class? Okay.
Yeah. So I'm
Okay,
like,
so
they just switched me and didn't tell me,
That's
but it's
okay.
okay. As long
You're-
as I'm getting my attendance taken, I don't even care. I'm just making sure.
you're here. Yeah,
Okay.
you're in my class. Yeah. Does anybody have any questions before we go through the quiz? Okay. All right, let's do this. And we'll try and cover some of our concepts too as we're reviewing the quiz. Okay. Let me share my screen here. Okay. Okay, so one of the things from your week 1 notes that was covered in the week 1 content was community-based nursing versus community-oriented nursing. Can anybody help the rest of us understand the difference? What's the difference between community-oriented and community-based? I'm asking for your participation. I don't like to call on students, but if I have to, I will.
Me, I put evaluating the outcomes of a community vaccination program.
Okay, that's okay. So let's step back. Let me. There's a big difference between community-based nursing and community-oriented nursing. Okay, the big umbrella is public health. Okay, community nursing falls under public health. All right, it's one of the entities within the public health environment. Okay, if you are working as a community-oriented nurse, okay, these are right in your week 1 notes. You are concerned about the whole population. I always remember it as I'm orienting myself to the community, the whole community. Okay, so you're looking at, well, you're looking at the population as a whole. If you are working in the community-based setting, that means you're based in the community. You're working in the community. So that could be a school nurse, that could be an occupational health nurse, that could be a hospice nurse, a home health nurse, immunization nurse. You're based in the community, taking care of individuals. So with that being said, it's a very stark difference. Community-oriented is looking at the whole population. Community-based is looking at the individual. Okay, so based on that, which of these is an example of community-based nursing?
I put educating
Educating a child and a
Mhm.
school teacher.
inhaler.
Yep, because you're working within the community. So this would be a school nurse. Okay, you're working within the community with an individual. Okay, the rest of the answers, developing a teen pregnancy prevention program is a big picture. So that's looking at the community as a whole. Okay, evaluating outcomes for a community vaccination program, that's looking through the scope of the whole community. Okay, providing diabetic education prior to hospital discharge, that's a community goal. Okay, where when you're educating a child and a school teacher on the use of an inhaler, that's community-based. Does that make sense? You do have to understand the difference between community-based and community-oriented. Does anybody have any questions about that? And we'll review that in your week 1 notes.
So, okay, just
Basically,
to
our video was
reiterate,
not opening.
Hang on 1 second. Go ahead, Jacqueline.
okay, so with educating a child and a school teacher,
Mhm.
so you're saying that if we educate the teacher, then the teacher, she's better equipped to serve the community, which is the classroom, right?
Correct.
Okay. Okay,
Yes.
thank you. I understand that a whole lot better
Yeah.
now.
Okay. All right. So just remember that let's go to your week 1 notes here. It's the first right here. Right here. Everybody see my screen? So here's your introduction to community nursing. All right. So if you're community oriented, you're looking at the big picture, right? Your focus is the community or the population, primarily focused on health promotion rather than illness care, right? You're looking at the whole group of people versus the individual, right? If you go to community-based, you are based in the community, okay, but it's more of the illness care of individuals in the community. Like I said, home health nurse, hospice nurse, school nurse, occupational health nurse. It's focused on illness care instead of health promotion or health maintenance, right? So that's the big difference. Jacqueline, does that make sense now? Better sense? We do need to understand this going forward for the rest of the term. So does anybody have any questions about that? Okay, let's go to number 2. which describes the purpose of the Healthy People 2030 campaign. Now, this was an assignment in week 1. Okay, it was in if you look at your syllabus, it would have been in the middle section, right? It was part of your readings. You were asked to go to the Healthy People 2030 website and have a look around. Did anybody do that? Okay, so if you did do it, you would have been able to answer this question. And if you haven't done it, I would encourage you to do so, because on all the exams and the HESI, you're going to get Healthy People 2030 questions. Okay, so which describes the purpose of the Healthy People 2030 campaign? What's the right
Is it trying to
answer?
prevent diseases?
So which one is it? Remember, it's a national campaign.
I put it provides a
said
framework
A.
to improve the health of
Yeah.
all
Yep,
Americans.
That's
it
what I put.
provides a framework, right? It provides a framework to improve the health of all Americans. Okay, if we jump back to our notes here from week 1, it's right here. Okay, so if you reviewed your notes, you're prepared for this. If you didn't, okay, so Healthy People 2030, national objectives to improve the health and well-being over the next decade. So it's big picture. It's looking at the health of everybody. Okay, attain healthy, thriving lives, well-being of preventable diseases, disability, injury, and premature death. Okay, these are their 5 overarching goals. All right, eliminate health disparities, achieve health equity, attain health literacy to improve the health and well-being for all. One of their other goals are create social, physical, and economic environments that promote attaining full potential for health and well-being for all. And that's the key. It's for all. It's not for a specific group of people, which were your other answers in the quiz. This is for everybody. Promote healthy development, healthy behaviors, well-being across the life stages. Okay? So let's go back to the question. Number 1, that's the correct answer, provides a framework to improve the health of all Americans. So if you look at those 5 national objectives, what do they all say that's in common? It's for all, right? So it doesn't establish a guidelines for treating the most common chronic diseases, right? Because it's looking after all. It has nothing to do with a nursing curriculum, okay? And it has absolutely nothing to do with changing the focus from community health to individual health. That's within public health. Okay? So does that make sense? And do look at their website, or actually, if you have a good understanding of those 5 overarching goals that we just went through, that's what you need to know for future exams. Okay, there are 5 overarching goals. Okay, question, and actually, it's a really good website. We started, I think it started with Healthy People 2000. And then we did Healthy People 2010, and then Healthy People 2020. And last year we just transferred over to Healthy People 2030. So this has been going on for 25 years. And the website gives you a history. It's interesting to look back at what the goals were 25 years ago versus now. So have a look at that website. Okay, number 3, which is true regarding uninsured versus or underinsured individuals? What's going to be a problem? What are going to be risks with uninsured, underinsured individuals? Why is that a problem?
Because they don't receive the preventive care that's needed.
Exactly. Right? There's going to be issues with access, right? I mean, if you're underinsured, uninsured, there's lots of risks associated with that. Jacqueline just said the most important, which is well, we can talk about the correct answer here, which is they're more likely to be diagnosed with advanced diseases because of what Jacqueline just said. They don't take advantage of, well, there may be very limited access, right, to preventative care. And so therefore, what happens? When we finally see them or they come to see us, they're much more likely to be diagnosed with a more advanced stage of what they have. And that's really important to know because as we talk about vulnerable populations and all the risks associated with vulnerable populations, insurance is a huge factor. And especially if kids aren't insured. You know, do they have access to their vaccinations, their annual visits? Okay, so the rest of these answers are actually the opposite, right? They are less likely, they're less likely to attend preventative wellness visits. They're more likely, they're more likely to develop preventable illnesses. Obviously, C is the correct answer. D, they're just the opposite. They're more likely to need governmental health resources. So as we talk about vulnerable populations through this whole term, insurance, being insured or not insured, is a big factor for vulnerable populations. Access. Then when we go through, and then next week when we talk about rural populations and uninsured and rural populations, another huge risk factor. Does anybody have any questions about question 3? Okay, question 4. This comes from week 1 in your introduction to vulnerability section concept that we covered. Okay, so which client belongs to a vulnerable population? What are the correct answers here?
Would it be all but the last one?
Okay, so Erica, why is A a vulnerable population?
Because she's pregnant and she's more susceptible to diseases and harm.
Then that would make every pregnant person, every pregnant woman a vulnerable. What should that state to make it vulnerable?
If she's young,
Teens. Teen pregnancy is the vulnerable population.
Yeah.
Okay? Because we don't consider every pregnancy vulnerable. I mean, some may be, but what we consider vulnerable is the teen pregnancies. Does that make sense?
Yeah, but I just know that when you are pregnant, you are more vulnerable than when you're not. So
Absolutely. Absolutely. But for consideration of vulnerable populations in general, every pregnant woman is not considered vulnerable. That's why we make it more specific and do teen pregnancy.
Okay.
Okay.
Gotcha.
So the correct answers are a veteran. Is a veteran a vulnerable population?
yes,
Okay. What about a substance abuser?
Yes.
yes,
Somebody with HIV?
yes,
Yes.
Yes. And then D is not. So the correct
No.
answers are B, C, and D.
I have a question.
Sure.
Are the exams gonna be like this?
What do you mean?
I feel like a lot of these questions are not trick questions, but they're really like, I don't know. I feel like it's kind of hard to get these answers from the book.
That blueprint, the
Uh-huh.
blueprint that she sent out, I didn't even look at it before this quiz, I'm gonna be honest with you, but I just looked at it now because she
Right.
showed it to us, and it
Right.
literally has everything on there
Correct.
that I was not aware of. So just make sure you look at that blueprint and read it really good.
Okay.
Well, hang on. I worked really hard on those weekly blueprint concept notes for you guys.
There's so much to read over. I literally just
Yeah.
skipped over it. I didn't see it. I was
I think-
focused on everything, and that's
Yeah.
the only thing that I missed.
I work
So,
really hard on those notes to give you
Yeah,
guys.
no.
It's a great overview. And that's why I
Yeah,
said at the beginning,
it really is.
Which blueprint? Which
I
blueprint? are
really
you
liked it.
talking about?
I
I
give,
should have.
Which blueprint?
Okay.
are
Yeah,
you
where is
talking
y'all
about?
getting this
Hang
blueprint
on,
from? Is it in the
hang on.
magazine?
hang on, everybody. Hang on, everybody. Hang
Where is
on.
the-
Hang on. Let's go. If you guys aren't looking at, my weekly blueprint notes, then
Because
come on.
I think everybody went to modules and just was like looking under everything
Yeah,
under
look.
modules.
Where?
Yes,
Hang
ma'am,
on,
I've
hang
gone
on.
through this blueprint, but I didn't understand what is the concept of community nursing because your video was not working.
My what?
Yeah. You had a blueprint?
Right here. I
Yeah.
sent you. Hang on, guys. Everybody just hang tight. Okay, I'm going through my announcements. Okay, I told you I send you a weekly announcement
Where is it?
every week. Okay, so where's our week one? Week one, content, information, announcement,
didn't see the
attachments.
blueprint.
Hang on,
Oh my
hang on.
God.
And at the bottom, I tell you in here, week one blueprint concepts are
missed that.
attached to this announcement to help guide you and summarize the weekly content material that will be covered. I don't know how more specific I can be. So here's your week one.
I missed it.
It's
don't know how I
okay.
missed
It's
it.
okay. It's okay.
No,
Don't worry.
it's not okay. No, it's just not okay. We're not in the right direction. It's really bothering me.
Well, so there's your week one notes, okay? And then my announcement for week two, okay? I try and go through and tell you what are we going to cover? I mean, there should be in 3 different places. All I do is copy and paste this from the syllabus. The concepts are going to be covered. The readings, I even put your readings. I copy and paste your readings in here. Okay. Here's your PowerPoints. I even copy those to put in there. Okay. And here's your week 2 concept notes. This is all of what's on the quiz. Okay, like Erica said, shoot, I didn't look at those notes, but now that I'm looking at them, everything's there.
Yeah, I wish I would have went through it a lot deeper
Yeah.
because most instructors do not provide that
No.
much detail.
Of
Yeah,
course
that
they
was the-
don't. Of course they don't.
Okay,
But
we're all gonna look at it this week.
you have to. I mean, remember I told you guys last week, guys, I use the announcements for everything. Everything. You got to look at your announcements. And I told you in week 1, I'm going to be sending you weekly concept notes. And you know what? To be honest with you, I really don't have to send those. Though
Mhm.
that's really you kind of have an outline of my lecture.
Yeah.
Okay, so that's really my lecture guidelines, and I send them to you ahead of time so that you have an idea of the concepts that are being covered. Everything is really well, I take pride in everything being very well organized in this class. Okay, so if you start with your syllabus, okay, we went through it last week. I just copy and paste your syllabus into your weekly announcement. Okay. And then I actually copy and paste it again in the top of your weekly concept notes. So there's 3 places to see it. There's
Miss-
4. You see it the same information. There's 4 different ways I present it, and it's all the same. You see it in your module. Well, you see it in your syllabus, and then you see it in your module, right? Then you see it in your weekly announcement, and then you see it again in your weekly concept notes. It's all the same.
Miss
Go ahead.
Professor Marble, Professor
Yeah.
Marble, I just have one thing. I just went through your blueprint. Honestly, I just skimmed it, and the only answer that I found was the egg yolk. I mean, it had nothing to do with the vulnerable population. It had nothing to do with Healthy Treat 2030. It had nothing to do with
Yes, it
resilience.
does. It's
Yes,
all
So
in there.
basically,
it's
we
in
really
there.
have to. We have to.
Aaliyah,
it's all in
Aaliyah,
Where
there.
is it? Where is the resilience?
It-
Where is the Healthy
Aaliyah,
2030?
Aaliyah, the notes are not going to
Mhm.
provide you direct answers. It's having you.
I'm not asking for the answers. It's
No, it's
it's
literally
just
all in
that
the
there are
blueprint.
4 different ways you have to read.
I'm
There
not.
are 4 different avenues we've got to read. You know what I'm saying? There
I
are 4
don't.
different avenues.
So like when she goes over the answers, she's going back to the concept note and literally pulling it out so we have something to reference to. I understand that it may not have been clear the first time around, but we as a
Right.
class now knows
Now, no.
that the concept notes have the answers in there. We just have to do a little bit more reading. You don't have to go over the books and everything because the books are a lot. You feel me? If you feel like you need a little bit more education or clearance on what next to do, then you open your book. If you feel as if the notes are more sufficient for you, then you go through the notes and you reference your book when needed.
Do you want to be my teacher?
I wish, but
Come
I don't get
on.
paid for that.
That was a wonderful synopsis is what you just said, because when I develop my notes for you guys or my teaching, my outline for teaching, I look at the book. So I've already pulled that information out, right? The book, start with your notes. If you're not understanding your notes, then like Jacqueline said, go back to the book for further information. But this isn't a pod of 4 different pockets of information. Does that make sense? You're seeing the same thing 4 different times. I can't give you I don't even have another avenue to give you guys to give you the same information. If you are reviewing your weekly notes, this is the next gen format, which is hard. I know you guys are transitioning to next gen. Okay. Next gen expects you to have the knowledge by reading the notes, reading the book, however you're gaining the knowledge, and then applying that to clinical settings. Okay. That's what next gen is. So these questions on the quizzes, the questions on the exam are not, we've moved away from definition questions. Do you know, can you spit out the knowledge of what a vulnerable population is? No, we're going to ask you, now that you understand what a vulnerable population is, pick who's vulnerable, right? Up here in question, what's a definition of underinsured people? No, you should know that. What we want you to know is what are the outcomes of being underinsured? All right, so it's more clinical. It's asking about clients. It's not asking to repeat information you already know. Does that make sense? So these are clinical based scenarios or scenarios. Okay. Okay, can we keep going? Does anybody have any questions? Aaliyah, why don't you stay on after class? Okay. All right. Question number 5. This was in your notes as well. We talked about, when we're talking about vulnerable populations, One of the terms that comes up that we need to understand is resiliency. Okay? This is on your last page of your week 1 notes. So what is resiliency? Somebody tell me what resiliency is. What is it? What does it mean to be resilient?
Like strong, like not
Mhm.
giving up.
Mm-hmm. Yep. So I consider all of you resilient as students. You're going through a real tough program. Nursing school is not easy. Okay, you're plowing through, you're getting through, you're working hard, you're balancing a lot of different things, right? Because you have a particular outcome that you desire. So your resiliency is carrying you forward to be successful in this program. Okay, so that's an example of resiliency with all of you. Think about the lack of resiliency that vulnerable populations may have. Okay, just think about it for a minute. Okay, certain vulnerable, let's take the homeless. Let's take the homeless, for example. There's not a lot of resiliency, right? One of the things that we work on as community nurses with our clients is especially with the vulnerable populations, is to increase resiliency, increase their motivation, provide them resources, provide them avenues to get out of or make the situation they're in better. Okay. A lot of times it falls upon us as community nurses to try and build that resiliency with these populations. Okay. So the correct answer here in number 5 is resiliency reduces our vulnerability. Think about it. The more resilient you are, the more apt you are to be able to deal with your current situation. Okay? The other answers are the opposite, right? Resiliency decreases the likelihood that you're going to get sick. Right? The more resilient you are, the more you're aware of your risks, the more educated you are to reduce those risks. And resiliency does not depend solely on genetic predisposition. It's part of it. Okay, but resiliency can be developed, and that's number 4. Resiliency can be learned if you don't possess it. I can think of times, hard times in my earlier years where I didn't have a lot of resiliency. But we learn it and we move forward and we rise up. So resiliency, and that's going to be, I believe, I think you're going to get tested on, they're given a scenario, I think on exam 1 about resiliency. So please understand what it means. And please understand our role as community nurses in trying to build resiliency within our vulnerable populations. Right? A lot of times they're at rock bottom, right? They're at rock bottom. It's up to us to help start to build a foundation that they can improve their life circumstances. Okay? All right. Here's your week 2 notes covered school nursing. Okay? So this question is a scenario about kids in school. So what's the important part of this question? What's in this question that jumps out?
What
What's a
should
word
the
that
nurse take care of
jumps out?
first?
First. Kayla, right? First. Okay, so this is a priority question. Okay? This is a good example. Okay, this is part of my my mantra of test taking strategies. Okay, if you looked at this question and it was not a select all that apply, okay, and you start looking and you go, oh, well, that 7-year-old should be seen. Oh, that 9-year-old should be seen. Oh, well, there looks like there could be more than one correct answer. Okay, but it's not a select all that apply. You need to go back and read the question. You missed something. And that's a good rule of thumb going forward. Okay, if there is more than one answer that seems correct and it's not a select all that apply, you missed something in the question. You missed a cue, you missed a phrase, you missed a word. In this case, it would be, who do we care for first? So what's the right answer?
I chose the 9-year-old
Yeah. Why?
because it's complaining of the cough. You think airway first.
Exactly. And go back to your med surge. Go back to med surge, peds. What is a complaining of cough and unable to participate in PE? What are those common symptoms of?
Asthma.
Yes. Maybe an impending asthma attack. Right? So who do we want to see first? We have to think safety. We have to think ABCs, right? I mean, there's no question that all of these kids have to get seen in the clinic. No question at all. But who, according to the question, who has to get seen first? It's the potential kid that's having airway issues. Does that make sense? Okay. Anybody have any questions about that? Okay, in week 2, in your notes, we talked about different common childhood ailments. Okay, and that's what your discussion question was about. And one of the topics discussed was iron deficiency anemia. So this is in your week 2 notes. So what food should we be recommending for the child with iron deficiency anemia?
Eggs.
Why?
I don't know. I got iron deficiency anemia.
Protein.
But I just know.
I said because it's protein.
Protein. Protein. Anybody have a different answer than eggs? Okay. Question 8. The school nurse notes a dark discoloration along the neck crease in the armpits of a child. Before we even answer the question, what is that? What does that mean? You guys, what could that be a sign of? I'm pulling from your
I was
med
thinking
surg.
of
Childhood diabetics.
diabetes.
Exactly. Childhood diabetes. Yes, yes. Right? So let's assume could be a potential symptom of childhood diabetes. What do you want to do here? What's your answer, Om?
I put number B.
Yep. Advise the parents for a full medical evaluation. Okay, this is, do you know what you should know, what is a dark discoloration in the neck or armpit? What is that called? It's that acanthosis nigricans, right? You should have heard that in
Yes.
peds.
Yeah, it says like that.
Yes, it's hard to say. I don't even pronounce it the correct way. But one of the things in your diabetes review or in your reading is that is a symptom of potential childhood diabetes. So we want the parent to get a full medical evaluation. None of the other answers even make sense. Okay. Question 9. Which nursing intervention is priority for a child experiencing a developmental delay? Again, another important word in this question, priority. Okay, if you skip over the word priority and read these 4 answers, you could say, well, family history might be important. Maybe evaluating the environment for potential lead exposure, that could be a correct answer. So you can really identify two answers here that could be correct. But what does it say in the question? What is it asking?
Priority.
Priority. So what's the priority?
The first one.
Yeah.
Lead.
Right. That's one of our concepts to cover that we covered this week. There's a whole reading page on it in your modules or in your week 2 module, right? Kids with developmental delays need to be evaluated for potential lead exposure. Okay. Then the last question. Nurse notes kid's BMI is in the 90th percentile. Which intervention is appropriate? What is this? What is this a potential warning sign of if you're in the 90th percentile?
Obesity.
Obesity. So what do you want to do?
Reduce screen time.
Reduce the screen time. You want to get this kid up and moving, right? Obviously, we're not going to advise more frequent snacks during the day. Obviously, we're not going to recommend 100% fruit juice full of sugar. And there's really no need for an urgent medical evaluation at this time. Okay, we already know that they're in the 90th percentile. So they're under the care of a physician. They should be working on a plan with the family to hopefully reverse this course of obesity. Right? So encouraging parents to reduce overall screen time. So again, you need to take the information that you're reading in your notes in your book and put it into a clinical setting or put it into a clinical scenario. Okay, so if you didn't prepare, like if you didn't read the notes for weeks 1 and 2, then you probably didn't do great on the quiz. But if you did, then everything should have been in there. And I don't mean answers, because that's not how I do it. The information to understand the concept. If you understand the concept, you should be able to answer a scenario or a clinical question about it. Does that make sense?
I have a question.
Yeah, of course.
So we should solely rely on those blueprints in the reading versus lecture.
Versus what?
Lecturing, like our lectures.
I don't understand your question.
Like we should solely rely on the blueprints that you're sending and the reading versus your lectures. Like we didn't have a lecture last week, so.
Well, you had a recording of the lecture. You did have a lecture.
Yeah, but on the content, I'm saying we should just rely on the blueprint.
No, you had a recording of the content.
Mm-hmm.
That was in your week 1 announcement. I recorded a lecture of the content.
Of those questions.
No, in my week 1 announcement, I sent you the blueprint notes, and I also had an attachment of the lecture. Forget the orientation. You already got, you guys got that recording after we had class last week. You had an additional recording in your week 1 notes that was the lecture.
Gotcha.
Okay. And I said that in week 1. I said, I know we're doing orientation today, but you have the lecture or pre-recorded lecture of week 1 content.
Gotcha. I was kicked out, so I didn't know. That's why I'm clarifying.
Oh, okay.
Yeah.
Okay.
But thank you.
You're welcome. You're welcome. Anybody else have any questions? So as far as preparing for class, I would review your notes that I send, which is always at the bottom of the announcement. And I would start with reviewing your concept notes. And then if you want additional information or clarification or knowledge, then I would go to your book and supplement those notes with your book. How does that sound? Erica?
Sounds like a plan.
How does that sound?
Sounds good.
Okay.
Sounds good.
Okay. Quizzes are meant to be given at the beginning of class. It's just to get an idea of preparation. Like I said in week 1, this class does not have a whole lot of work. Hey, if you can carve out just a little bit of time to get your community work done, reviewing the concept notes, go into the book if you need to, if there's any reading in the modules. Okay, last week in week 1, there were 4 readings in the module, inside the module, right? You guys know what I'm talking about, right? Canvas readings built
Yeah.
into your module. Okay. This week there was 2. It was school nurse and I think it was lead poisoning. Okay. So if you're just carving out a little bit of time to review your readings, review the notes, you're all prepared for class. Okay. We're done with we're almost done with our 2 discussion questions, right? Discussion questions 1 and 2. You should have turned in your initial post Wednesday night. And then all you have left to do, if you haven't done it, is your 2 peer responses, right? For Sunday. And then we're done with discussion questions. There's no more. No more. You got a couple of case studies. You got some NCLEX assignments. Okay. You have a group paper due in week 7. Then you got those other things due in weeks 9 and 10. But discussion questions are over. No more Wednesday due dates for the rest of the term for you guys. Everything else is due on Sunday. So I can't reiterate enough to just carve out some time, review your notes, and you'll be fine. Now remember, quizzes are worth 1%. There's 5 quizzes, it's worth 5%. Okay. Not earth-shattering, but it just kind of tests your knowledge. It's not meant to be punitive or it's not meant to be gotcha. It's just giving, if you're reading the notes, these questions should make sense. Does that make sense? If you haven't done anything,
Yeah.
then of course it's going to be like, where did all this come from? Right? But by simply reading your concept notes and maybe reviewing the book, everything was in there. And it's just not a lot of preparation. I mean, how long would it take you to read through those concept notes and review the book? Maybe 30 minutes, right? But if you're not reviewing anything, you're not going to be able to do the quizzes. And that's the purpose of the quizzes, is prep. Okay? That's my, as my kids would say, that's mom's pop-off. That's my pop-off. Anybody have any questions? Like I said last week, this class is not hard. It's an introduction to different concepts that are going to happen, that are happening in the community. Okay, it's an introduction. Just to give you an idea what is community nursing about. This is not a hard class. And it doesn't have a whole lot of work. We already have our discussion questions behind us. All right. So I think that if you just spend 30 minutes, whatever you need to prepare for class, take your quiz, come to class, lecture. If you missed any of the lecture, review the recording. That's it. That's it, you guys. But it will become overwhelming if you're not doing the work, because you'll get into exam 1 and think, where did all this come from? Now, I'm going to be sending out a concept guide this weekend. Okay. And it's a review, which I don't really have to do either, like the weekly notes. But I do. Okay. So when you see this concept guide, it's going to cover weeks 1, 2, and 3. Okay. And everything on the concept guide for exam 1, you'll have already seen in your notes for weeks 1, 2, and 3. That's where I pull it from. I just target it more. I how do I say this the right way? I pull out the important pieces of your notes that I think are the most important pieces for you to understand about that concept that are going to be on the exam. Okay? And students find that incredibly helpful. And you'll see there's nothing on the concept on your study guide that there shouldn't be anything new on there. Literally copying and pasting stuff from your weekly notes. But I've really whittled it down to what you really need to know. Make sense? So, yeah. I mean, I heard a lot of frustration at the beginning of taking the quiz, and that's fine. If you didn't prepare for class, you're probably going to be frustrated, right? If you did, I mean, I saw some scores in there, 9s and 10s. So there were students that did prepare for class and got a 10 on the quiz. Remember, it's all you get what you put into it. Okay? Is that enough mom lecturing for one morning? Okay, Kayla, I'm going to move on. All right, so I want to go through in a little more. Oh, shoot. Am I still? No, I'm not. Let me share. Okay. So I want to go through. We already went through community-based, oriented versus community-based. The other thing I want to cover from week 1 is levels of prevention. You're going to hear this throughout the whole term. And I know you've been introduced to the terms, right? Primary, secondary, tertiary, right? The way I remember it, primary is prevention, P for P. Okay? Your interventions are trying to prevent something before it happens. Primary. Secondary is screening, S for S. Secondary, early identification, early treatment. We'll go through a couple of examples. Tertiary is treatment, T for T. Okay? Tertiary, they already have to have something. A kid's had an injury. They have a diagnosis. They have a condition. There's something going on. Okay? The one thing I want to be clear about is a lot of students get caught up when we talk about education. I don't want you to associate education with just primary. Okay? Education happens at all 3 levels. Okay, think about it. In the primary intervention phase, we're educating to prevent. We're trying to prevent something before it occurs. Prevention of illness, prevention of injury, talking about seatbelt safety, talking about safe sex, substance abuse prevention, healthy living, healthy diet. That's all about education, right? Education to prevent something. When we get into secondary, we're still doing education, right? We're trying to identify risk. We're screening. Mammograms, blood pressure screenings, risks in the schools. We always did screenings about risks for suicide. Who's at risk for suicide? Who's at risk for substance abuse? Who's at risk for obesity? We're screening. Then once you've identified that high risk group that potentially is at risk from your screening, you do education at that level too, right? Because you want to try and reverse it, right? And not let it get to tertiary, right? So we're educating it with early identification, early intervention. That requires education as well, okay? And then once we get to tertiary, there's still education. We're still educating. Okay, let's say you're working with a group of kids in school that have diabetes. You're working with them to help make sure they understand how to take care of themselves. How do they test their blood sugars? How do they give their insulin pump doses? Or an elderly patient has had a stroke. Okay, you're working with that patient, educating them on how to reduce their risk of falls, how to take their medication. Okay, so don't get caught up in education just being at the primary level. It's at all three levels. One of the some feedback I heard from my students a couple of weeks ago after they took the HESI, they said that there were several primary, secondary, and tertiary questions on the HESI. Okay, they were surprised at actually how many there were. So one of the things that we need to think about is as we cover each concept, like for example, in our week 2 notes, which we'll get to, when we cover each concept, for example, school nursing, I list out on my notes several examples of primary, secondary, and tertiary. Okay, primary, secondary, and tertiary happens everywhere and all the time. We just need to be able to identify some interventions at each level for each concept. So a primary intervention for a school nurse may look a whole lot different than primary intervention for a hospice nurse. Does that make sense? Primary intervention may look a whole lot different from a school nurse to an occupational health nurse, right? Occupational health is in the work setting. Okay, a school nurse is going to be looking at different things, education for prevention in the school versus education for prevention in the workplace. Does that make sense? They exist in every area. We just need to be able to identify specifics for each concept. Okay? So, Healthy People 2030, we covered. I want to cover social determinants of health. Okay? Social determinants of health, these are where we live, where we were born, where we go to school, where we worship. They determine our health. That's what social determinants, they determine our health. There's 5 domains that we look at for social determinants of health. Okay, and this is presented all through the term. Think about it. These are 5 common domains that everybody experiences. Okay, economic stability. Okay, economic stability, educational access, healthcare access, neighborhood or your environment. And then what does your social and community look like? Are there a lot of resources? Okay, so some examples. Okay, do you have safe housing? Is there transportation? Is there racism, discrimination, violence that goes on in the community? Are there gangs? High crime rate? Is there a good educational system? Are there job opportunities? Do people live in poverty? Do people live in poverty in your community? Is there a high unemployment rate? Do you have access to nutritional foods? Physical activities? Are there parks? Are there walking paths? Or rec centers? What is your air and water? Is it polluted? Do you live near a waste site? Do you live near a transportation hub? Do you live near rivers, streams that potentially could be contaminated? And then language and literacy skills. What do you do with the clients who don't speak English? What do you do? One of the big concerns in community health is low literacy. And I don't mean that condescendingly, low literacy with regards to health. Do they understand their diagnosis? Do they understand what they're supposed to do? All those are examples of social determinants of health. You know, if a family has, or an individual has economics, they're economically stable. They have good access to education for their kids. They have insurance, so they have health access. Their neighborhood's a fairly safe neighborhood. There's lots of resources in their community. Right? Those are things that help determine your health, the health of your family, the health of your individuals in your family. Does that make sense? So we know that social determinants of health, what we just talked about, contribute to wide health disparities and inequities. Right? For example, people don't have access to grocery stores with healthy foods, are less likely to have good nutrition. Right? Less likely to have good nutrition may translate into long-term chronic diseases down the road, heart conditions, diabetes, obesity. Right? So social determinants of health is introduced to you in the Healthy People 2030. And then we talked a lot about already introduction to vulnerable populations. Okay? Kids, we know the kids are vulnerable, right? They don't have anybody to advocate for them. We know that the elderly is vulnerable. Okay? They may be unable to care for themselves, physically, emotionally, financially. Some other vulnerable groups, chronic disease. Chronic disease is actually is where we spend our most healthcare dollars in this country with clients with chronic diseases. We talked about the non-English speakers. Okay? Very vulnerable. Okay? Let's see what else I want to pull out of here. Vulnerable populations, I'm right here, experience multiple cumulative risks. Right? You know what that means, right? They're sensitive to the effects of those risks, whether they're environmental hazards, lead exposure, pollution, social hazard crimes, violence, poor decision making, smoking, substance abuse, exercise, right? Vulnerable populations are at risk for all of that. A lot of times, vulnerable populations have multiple illnesses, multiple comorbidities going on at the same time. And here's where we talk about resilience. Okay, there's your definition of resilience. Okay, there's 2 bullets that talk about resilience in your notes. Right? Another issue with vulnerable populations, and remember, this is in the concept of introduction to vulnerable populations. This is your intro in week 1. We're going to cover several specific vulnerable populations in the coming weeks. Vulnerable populations, a lot of them feel disenfranchised. Do you know what that means? If not, have a look at this paragraph. They don't feel like they're part of anything. Again, think of the homeless. They feel like they're on the outside. Everybody else has forgotten about them. Unimportant, unseen. Disenfranchisement means that you feel like you're separated from your community, separated from society. Right? There's really very little emotional connection within the larger society. Some groups of people that may feel disenfranchised, homeless, migrant workers, the rural populations. Okay. Vulnerability is also compounded or exacerbated by lack of resources for healthcare, lack of resources in the community to help them, and poverty. Poverty is huge. Okay, poverty and low education levels contribute to social conditions which make these populations more at risk. Poverty, and I think this is in our week 2 notes, poverty is the most important factor in determining the health of individuals, families, and communities. And one thing I should have mentioned early on is think about the difference between, think about who your clients can be in the community. Okay, we already talked about week 1, they can be anywhere across the lifespan, right? Individuals, or excuse me, infants all the way up to the elderly and everything in between, right? But your clients in the community can be an individual themselves. It can be an entire family that you're working with. It can be a subset of the population, say the homeless or substance abuse or hospice, or it could be the entire population if you're working under the community-oriented model. So remember that. When you go to your clinicals, you take care of a group of patients, right? Individual patients. When you're out in the community, it could be an individual, a family, a group within the population, or the whole population. Okay, so back to poverty. Poverty, low educational levels contribute to social conditions in which you're going to see the risks or the disparities, right? Often the poor live in unsafe areas, work in stressful environments, have less accessibility to healthcare, food, exercise, and they're more likely to be uninsured or underinsured. That's where that question on the quiz came from. Okay. Uninsured are less likely to seek preventative health services, right? That was your quiz question, right, Erica? That was your quiz question.
Yes, sorry.
Right there.
Yep, I see it.
Yep.
Now,
Wasn't in the blueprint. I just have to get it together, that's all.
This is the blueprint. Aaliyah, this is the blueprint. This is what you got in week 1. These are my lecture notes that I share with you. You have it all right in front of you. Okay, let's see. I think that's it for week 1. Oh no. Oh, here's what you guys need to understand. This is important for this class. Poverty is the primary cause of vulnerability. And it's a growing problem in the US, right? We have certainly seen that through the pandemic, have we not? Yes. Okay. The rest of this you can read on your own. I want to jump to this. Just continues to go through other vulnerable populations, your veterans, outcomes of vulnerability. Let's talk about that for a second. Increased morbidity, increased mortality. Makes sense, right? High prevalence of chronic diseases, high prevalence of communicable diseases, your TBs, your hepatitis, your STDs, right? Vulnerable populations obviously have a higher mortality and morbidity rates than the general population. Then this last section is, I'm not going to go through all of it, but I want to go through what I've highlighted. Interventions, how do we care? How do we help care for the vulnerable populations? First and foremost, okay, these are vulnerable people. Most of them don't want to be where they're at, right? Community nursing is hard when you're working with the vulnerable populations, okay? You need to be able to show respect, show compassion, show concern, non-judgmental. Okay, not making assumptions. If you think of working with the homeless population, okay, let them tell you their stories, right? In nursing in general, but much more so in community nursing, the trust issue, I guess that's what I'm trying to say. Trust needs to be established with these populations before they're going to open up to you about what their needs are. If you think of let's say you have a homeless family, mom with young kids. She doesn't want to be there, right? Let her try and establish that trusting relationship. So she may open up to you and let you give her resources for the kids to get vaccinated or the kids to get in school. Okay, it's really draining working with vulnerable populations. It really is. Okay, and so you got to take care of yourselves as well. Okay, so that's our introduction to vulnerability, because in the community, most of our work is with vulnerable populations, is it not? Okay, you may work in a long-term care facility in the community. You may work in an urgent care. You may work in a medical office building. Okay, you may work as a home health nurse. Doesn't matter where you work, you are going to be working with vulnerable populations. Okay. Let's cover, here's our blueprint for this week, right? There were things, here's our concepts to be covered, like school nurse, growth and development, your common childhood ailments, which you did a discussion question on, and then your family nursing, family health risks. Okay, so these are your blueprint notes. I gave you all the readings again. Okay, you had your 2 Canvas course readings, school nurse and lead exposure, which were built in. School nurse is my favorite thing to talk about, school role in community nursing, because that's what I just retired from for 22 years. And so I can tell you that the days of school nurses putting on Band-Aids and giving hugs are over. Okay, it's just not that way anymore. Very inclusive. By the time I left a couple of years ago, I was a full-blown COVID nurse, but I also we did very inclusive. So we had students with multiple complex chronic conditions, trach care, replacing trachs, IV medications through PICC lines, cathing, male and female students, suctioning, trachs, emergency care for allergies, emergency care for seizures. We do it all in the schools now. And for those of you that have kids in schools, I don't know if you're aware of the nurse's role in your schools, but the school nurse role right now in the healthcare team within a school is critical. Okay, so the nurse may be a direct caregiver, which I just described some of the tasks I would do. Definitely a health educator. That's most of what you do, right? I could start out one day in a preschool teaching good hand washing and finish up that day at the end of the day at the high school talking about substance abuse prevention. Okay, lots of health information about growth and development, about puberty, substance abuse prevention, hand hygiene, acute illness prevention, diet, exercise, obesity prevention, lots and lots of education. Okay, consultant. We are right in the middle of the teachers and the students and the administrators. As a consultant, we worked with teachers and administrators to understand what was going on in their school. What kinds of health issues do you have going on? Who has an EpiPen? Who has an inhaler? Who has glucagon for diabetes? Here's where their insulin's stored. Okay. And then a case manager. Nurses are always working as case managers, but I felt like a case manager really all the time. because you're as a case man, and we'll talk about case management later in the term, but case management is simply the coordination of care. Okay, in the schools, when you have an impacted student, they may be on an IEP, the individualized education plan, where you have to help coordinate all the services the student needs. They may need PT, they may need OT, they may need speech. Okay, they may have medical issues. Okay, you as the case manager for those kids are involved in all that planning. Okay, and then school nurses do a lot of community outreach. We did a lot of vaccination clinics. We did a lot of health education seminars and programs. We're out in the community at health fairs doing blood pressure screenings, blood sugar screenings. So a lot of stuff. School nurses are an integral part of the schools now because there's so much more happening in the schools, right? So much more happening in the schools. All kids come to school now, irregardless of their medical, their psychological, their emotional needs. We accommodate all of those needs in the school setting. So the school nurse is a critical role in the healthcare team. And then here's your examples that I was talking about. You have several examples of this is the first go around of identifying a concept such as a school nurse or school nursing, where we have to think about what does a primary intervention look like? What is a secondary? What is a tertiary? Okay, so here's some examples. I'm not going to go through them all, but let's look at primary, providing education to prevent childhood injuries, prevention of substance abuse behaviors, reducing the risk of disease. Okay, those are all preventative, right? Secondary, we're screening, early identification, early treatment of a condition. That may be lice screening, conjunctivitis, pertussis. You're screening. Okay, you're screening for risks of kids with obesity, with allergies, asthma, allergies, anxiety, depression is a big one. ADHD and bipolar. Here's in your notes where your ankethosis came up, or for your quiz, right? What is it? What does it signify? What do we need to know? So that's where that came up. And then we're always screening for abuse and neglect. Right? Remember, we're all mandatory reporters. We do vision and hearing screenings, scoliosis screenings, trying to identify bullying behavior. Okay, and then tertiary, they have something's going on. So you may be working with them, say, for medication administration. Okay, kids take meds in schools. Okay, so maybe working with medication administration, making sure they understand what the side effects are. They take their meds on time. They know when to come to you if they have an issue. Okay. And then again, here's your teaching, your education part, the tertiary level, teaching students, parents, teachers how to manage chronic illnesses. Let's say the kids have asthma or diabetes. Okay, so that's your education part. And let's talk about family nursing health risk. What's the definition of a family these days? I'm asking you guys. What's the definition? Is there a definition? The answer is really no. It's whatever they say it is. Right? Family is essentially the people who provide physical, emotional, and financial support. Okay, non-traditional families are now the norm, right? So one of the things that we talk about when we talk about family is what's the difference between a functional family and a dysfunctional family? If you're out in the community working with families, you got to Understand this. There are certain characteristics of a family, a functioning and a dysfunctioning family. Okay, so there's 5 main functions we look at with every family. Okay, when we're doing our ADPI, when we're doing our assessment of the families. Okay, and these 5 are, what's the financial situation of the family? What's the health situation of the family? What's the reproductive situation of the family? Socialization and affective. So for example, functioning family. These are examples of functioning families. So the opposite would be non-functioning. Okay, so financial planning, or is the family planning for the future? Are they making good financial decisions? Do they have a roof over their head? Do they have health insurance? Health, with regards to health, are we teaching healthy behaviors within the family? Are we teaching health maintenance? Are we promoting good diet? Reproductive, perpetuation. Well, that's having kids. Are families having children in a responsible way versus an irresponsible way? Socialization. Right? Are we raising our kids to try and fit into society, to become productive, responsible, well-adjusted adults? Do we pass on our cultural, our spiritual, maybe our religious beliefs? Are we passing those on? Okay. And then affective. Are we creating a sense of identity, sense of belonging through affection, love, spending time together and bonding? So those are 5, those are the 5 traditional functions of a family. It looks different in every family, right? Some families are functioning, some are not. Okay, but failure to meet these functions leads to dysfunction, leads to crisis, right? Some contributing factors that may play a role in the way a family's functioning: substance abuse, anxiety, depression, unemployment, unsafe sexual practices. Okay, we typically see family as our most important safety net. Okay, without it, there is a tendency toward maladaptive coping mechanisms. Okay, so if you're working in the community, you're going to be working with families. Okay, and then a couple of family health risks. Okay, can be looked at in 3 different ways. Are there genetic risks? Are there environmental risks? Are there lifestyle behavior risks? We have to consider all 3 of them. We know genetics, we're born with certain predispositions, right? May have a family history of cancer, maybe you have a family history of alcoholism, family history of heart disease. Okay? Environment. What is it? What about our physical, social, and political environment? How does that affect the family risks? Do you live in a high crime neighborhood? So your environment, do you live in a high crime neighborhood? Do you have poor air quality, poor living conditions? You're living in a high stress environment. Okay. And then behavioral, those are our choices. Do we choose to be obese? Do we choose to be our lifestyle choices? Do we choose to use illegal substances? Do we choose to drink? Right? Do we choose to eat unhealthy? Okay, so these are potential risks. Potential risks can come from genetics, can come from simply the environment you live in, and then certainly from your lifestyle choices. Okay. And the last section that you can read on your own is your common childhood ailments. It goes through each one that's listed out in your readings. Okay. And several questions from the quiz came from this. These are the bullets that you should understand to have an understanding of what the ailment is. A lot of this also could have been used, a lot of this information in your week 2 blueprint notes could have been used on your discussion questions, right? Some of you may have used this information, but it lays out the common childhood ailments. And this is a big chunk right here. This is a good example of med-surg. Med-surg being incorporated into this class. Okay. And I can tell you that I think there's at least one question on each of these 8 childhood ailments. I think there's at least one question on the exam about each of them. So you do need to know them. So, which is why we double dipped and had you do a discussion question about them, as well as a concept, understanding them as a concept, right? Because common childhood ailments, if you're working in the community and you're working with kids, like in school nursing, I dealt with every one of these all the time. Okay. So that's a summary of your week 1 and week 2 content coming directly from your blueprint notes that you have. This weekend, you'll get a week 3 announcement. And at the bottom, it's going to have your blueprint notes for week 3 attached to it. Okay. Does anybody have any questions? Is this helpful? Helpful information?
Yes, thank you.
Yeah, you're welcome. You're welcome. We already went through it. I'm going to be sending you over the next couple of days. Stay on if you have questions. You know how to reach me. Have a good weekend. Good to see everybody. Don't flip out about quiz 1. Okay, let's just keep moving forward. Okay, keep
Thank
moving
you.
forward. Don't. Okay, bye, Om.
Bye.